People suffer in homelessness.
Folks struggling with mental health diagnoses, physical health diagnoses, folks with young children, a variety of barriers that people have in their life. This housing market continuing to rise is exacerbating housing insecurity, which then leads to homelessness in our community.
Having a stable place to stay at night is really crucial to being able to think about other things in your life. It's really difficult to think about that next job or that next educational opportunity when you're thinking about, well, where am I going to sleep tonight?
When you live in homelessness, especially when you have an untreated mental illness and an addiction, you are just trying to survive.
What we find is if folks can get into housing and get stable in that way, and in a sense have a sense of safety, then they're better able to start working through some of the other challenges that they're facing.
Housing, it is foundational to life. It's simply the starting line. And what people do with that opportunity of stability is really up to them.
I had experienced some housing insecurity growing up, and as a refugee coming to this country, clearly knew without having a safe place to sleep in, everything else is a band-aid. So that's what really made me focus on housing for people with special needs. The 15 homes are for people impacted by serious mental illness. 5 of the homes are prioritized for veterans impacted by chronic health conditions. The best part is we also had a diverse group of funders who came together, private foundations, the county government, managed care organizations like Lions, all of them coming together and providing that amazing support for us to make this a reality here.
SCCU, the Rise on Clanton, is a permanent supportive housing community. Just a couple of years ago, it was a functioning hotel. In the midst of the pandemic, we had the opportunity to purchase it. We utilized it as an emergency shelter for several months before beginning renovations. And now it is home for 88 people coming out of chronic homelessness.
We're going to reduce homelessness in the Triangle, and specifically in Raleigh. This project with 100 units is going to have a serious impact on homelessness in our community. And so we are actually bringing together support services on the property. So there will be case managers, there will be peer support, we'll have medical services available. And so we're going to not just bring people into a home, we're going to connect them to the community at large to make sure that they have a lasting future here and a safe, affordable place to live.
I would say in the past couple of years, things have changed very drastically in our mental health system. And a lot of people have dropped through the cracks. They've not gotten services. I think that's what the biggest key is we're working together as a team to help these people have the best services, the best care. Then it helps everybody in the community be better.
This is a place-based initiative where we purchased 42 units that were highly distressed, and I've invested $10 million into renovating it for affordable housing. It's very rewarding to see someone find a home where they feel safe, where they're financially secure, and they feel a part of the community. Alliance has always been a great partner in helping to serve those who need housing. They've invested into 3 of these units that will be reserved for their clients. That financial investment and the ongoing support is essential to being successful in housing their population.
I remember the first time that Alliance made a capital investment into affordable housing. And we were like, okay, I guess that's okay for us to do. And of course it was, you know, because now we think about the people that we have living there, and we are able to track them to say, this person hasn't been back to the hospital, this person, you know, got their driver's license, this person reunited with their children. I mean, those are the stories that you hear, and I absolutely believe that housing made that possible for them.